Well, pancreatic cancer is the sixth most common cause of cancer death globally. Now, a new drug is being hailed as one of the biggest breakthrough in decades, as it can potentially double survival time in patients diagnosed with pancreatic cancer.
This was part of a clinical trial finding on the drug called Daraxonrasib, presented at the American Society of Clinical Oncology's annual meeting in Chicago. The trial involved 500 patients from North America, Europe and Asia, all of whom had pancreatic cancer. Now, how is this drug effective? As per the research, it works by targeting a protein called KRAS that fuels the growth of all pancreatic cancers. As a result, patients who took this drug lived substantially longer, for an average of 13.2 months, as compared to 6.6 months for patients who had chemotherapy. Now, this is not all. Apart from extending lives of patients, the drug taken once daily also caused fewer side effects as compared to chemotherapy.
For instance, 43.6% of patients on Daraxonrasib experienced severe side effects, in contrast to 57.5% of those on chemotherapy. Now, why is this development significant? Pancreatic cancer is often detected late, as symptoms do not appear in early stages. Limited treatment is available, and more than half of people with pancreatic cancer die within 3 months of diagnosis. This form of cancer also has one of the highest recurrence rates, and in another crucial breakthrough, researchers found that an injection of amivantamab shrank the tumors in over 1/3 patients with head and neck cancer.
Among the 102 persons who were administered the jab across 11 countries as part of a clinical trial, tumor was completely eradicated in 15 patients. As per researchers, the injection showed similar results in patients with lung cancer as well. Amid all of this, a recent report has laid bare how cancer will continue to remain a major health crisis across the world, both in terms of growing cases and manpower shortage.
As per a report published by Lancet Oncology, the situation is dire, with 1 in 3 cancers globally not being diagnosed at present. However, the crisis is set to exacerbate, with the report predicting a 21% increase in cancer incidence. While about 20 million people are diagnosed with cancer annually, it can rise to 35.3 million by 2050. It also projects a shortfall of 100 million cancer care workers by 2050, which includes about 65 million nursing staff and 16 million diagnostic staff. The report recommends that investing in cancer workforce can avert 170 million cancer deaths between 2030 and 2050, and even deliver $120 trillion in net economic benefits.